St. Louis County's long-term care facilities have reported more than 2,320 cases of COVID-19 and 494 lives lost since the pandemic began in March. This is based on a new report issued by the Department of Health that is available on our webpage, stlcorona.com. This is called the August Long-Term Care Facility Report. As distressing as these numbers are, the report shows that the vast majority of cases occurred early on in the pandemic before many of our protective measures were fully in place. For example, in April, our county saw 813 cases of COVID and 147 deaths in our long-term care facilities. In May, we saw 681 new cases and 212 deaths in long-term care facilities. The report, which was published today, shows that the numbers have gone down considerably. There were 306 newly diagnosed cases in August and 33 deaths. In July, by comparison, there were 256 cases and 33 deaths. The report adds some cases from previous months that were not reported on the Department of Health's report in July. The Missouri Department of Health and Senior Services had changed their database in the beginning of August, which caused a delay in reporting of some cases. All in all, 216 cases were added to the totals from March through July. The new report shows that the fatality rate of long-term care residents who are infected with COVID-19 is 21.3%. These cases account for 12% of the cases of COVID-19 in the county, and they account for 66% of the deaths of COVID-19 in St. Louis County. The report describes the effect of COVID-19 on residents of 144 long-term care facilities licensed by the State Department of Health in St. Louis County. It also includes data reported directly to the Department of Health from other types of facilities, including skilled nursing facilities, intermediate care facilities, assisted living facilities, and residential care facilities. The Department of Public Health in St. Louis County works with these facilities to ensure aggressive mitigation measures are in place. This includes assisting in providing personal protective equipment and ensuring that testing is readily available. This vital work is done in coordination with the state of Missouri, and which licenses these facilities, and the St. Louis County High-Risk Task Force and the St. Louis County Emergency Management Team. The existence of cases in these facilities should not be considered an indictment of these facilities. Close quarters, the age of the residents, chronic medical problems, all have made these residents particularly vulnerable here in St. Louis County and even across our country and across the world. The extensive work to protect residents of long-term care facilities in St. Louis County has been recognized by the Federal Centers for Medicaid and Medicare Services. In particular, St. Louis County was recognized for establishing a high-risk task force comprised of volunteer doctors and nurses to help with communication between these facilities and the St. Louis County Department of Public Health. This ensures that facilities have the proper PPE and other equipment that they need. Out of that high-risk task force came the Quick Response Team, another layer of support for our nursing homes. When there is an outbreak in a facility, the team goes in with testing, PPE, and deep cleaning of the facility, all within 24 hours. This process with the Quick Response Team has now been duplicated across the state of Missouri. Our Department of Public Health remains diligent in working with these facilities to keep residents safe. Before I take any questions, I'd like to remind everyone that under our public health orders, anyone planning a public entertainment event, including festivals, Oktoberfests, Halloween parties, must first present a health and safety plan to our Department of Public Health. Plans must be submitted 10 days in advance of the event, and events cannot occur without the approval of the Department of Health. These plans are meant to provide for the safety of our residents and make sure all proper safety measures are in place for all public events. For more information, please visit stlcorona.com or email our Department of Health at business-covid@stlouisco.com. Thank you, and I'd be glad to answer any questions.
Obviously, since your announcement on the youth sports, there's been a lot of backlash from people who disagree. What is your response to the backlash and the anger we've seen since that announcement?
Well, most of these decisions surrounding public health and welfare and safety are difficult and complex. And with every public health order since the beginning of this pandemic, there has been initial pushback and concern and expression of those concerns, and we process those in the Department of Public Health, and we make adjustments whenever possible, but we will always put the health and safety of everyone in our community first. The city of St. Louis has a slightly more restrictive health environment, and it's been interesting that we haven't really heard much from parents in the city of St. Louis, but we may. But they, in St. Louis County, our parents and our community is certainly much more engaged. They've been engaged in this conversation since the beginning of the pandemic, and we have had very frank and open discussions with every industry group that has approached us because their sector has been negatively impacted by this pandemic, and we will continue those discussions, and we will continue to work with all interested and affected parties.
Another question for you. The conversation for a lot of people has been, I know you said that the reason for the 15 to 19 not able to play was the 20% transmission rate. Could you kind of go back over that and explain for people in conversation saying, well, what's the difference between my, child this age and then the children 15 to 19?
Sure. The positivity rate among the 15 to 19-year-olds is 5 times higher than the positivity rate in the younger kids under 10. The positivity rate in the 15 to 19-year-olds is 20%, and in the younger kids it's 6%. That, combined with some high-contact youth sports, has led our public health experts and advisors to determine that there are some types of youth sports that should be restricted in their activities, games, and competitions, and should only be allowed to scrimmage and practice. And we're following those guidelines. We're following the recommendations of our public health experts, and we'll continue to do so across all sectors that are affected by this pandemic.
What is your response to people who say, well, St. Charles County has been playing, Jefferson County has been playing, they've been competing. Why is he abusing his power and not allowing the students to play?
Well, I am reporting the decisions made by our advisory groups and our public health experts. And my authority in St. Louis County is there to protect the health and welfare of everyone here. And I'm following the advice of our experts here in St. Louis County. We have different demographics, we have different conditions, and we have a very alarming positivity rate among the 15 to 19-year-olds. And that's why we made those decisions. There are different jurisdictions in the state, and there are different jurisdictions in the country that have different public health orders. Some have mask mandates, some don't. Some limit business capacities, and some don't. And then we see the results of that in other parts of the country and other parts of our state when there are less restrictions. But this is a very serious and challenging time in our history. We're not out of this yet, and we have to move forward with the right mix of protection for public health and mobility in our public health orders to keep our economy moving forward and to allow our residents to move as freely as it's safe to do so.
And there's the task force, the sports task force, they're saying that that you haven't been in conversation with them and their suggestions. What is your response to that?
Well, there is a youth sports task force and advocacy group that our St. Louis County Department of Public Health works with and meets with on a regular basis. That is similar in name but much different than the St. Louis Metropolitan Pandemic Task Force. So 2 very different entities and organizations. The County Department of Public Health is in constant communication with this task force which advocates for youth sports, just like they are in constant communication with other interest groups and other industry advocates. And those conversations will continue. I do not sit in on the meetings of every advocacy group that communicates with our health department, but I do trust our public health officials to work through those conversations. It is common when our advocates for whatever business sector that is communicating with our Department of Public Health, it's common when they are not completely satisfied with those conversations, that they would like to appeal those decisions by our public health experts to me and ask me to overrule their decisions, and I don't do that. I support the decisions of our public health experts and our medical advisory group, and we lean very heavily on the support of our health systems and the pandemic task force, and we work closely with other advocacy groups in every business sector.
So as we get closer to the end of the first 6 weeks for school, what are you foreseeing as far as moving into the next phases with students being able to have in-person learning?
Well, we're working very closely with the superintendents. We're in constant communication with them to help them develop guidelines to transition from a virtual learning to a hybrid model or an in-classroom model, or whatever each superintendent believes is appropriate for their students. We do believe that the data supports that it is safe to allow in-person learning for the younger kids because the positivity rate is much lower among kids under 10. So we're working with the superintendents to develop plans that work with their timelines that are specific to their individual school districts and their staff to find a path forward to get kids back into school on a timeline that works for each individual school district.
Sam, we have a couple more questions. One, sort of piggybacks on what Blair was asking. There have been some opposition to the sports restrictions, saying there are no COVID-19 cases linked to these sports. Is that true?
Oh, we have many COVID cases that are among many members of youth sports teams. We do not release individual names for privacy, but we do have cases amongst many members of youth sports teams, many people on the same team, and we'll continue to try and protect those team members and those individuals as appropriate.
Also, a question from a call regarding an increase in cases in the Oakville zip code. They had the highest number of increased COVID-19 cases in the last 7 days. Do you recommend that younger children should attend school in person, even in areas where cases are increasing? And why do you think this is Oakville is the hot spot right now? Is it because of the proximity to Jefferson County?
Okay, so the question is about the high number of cases of COVID-19 in Oakville and in South County in general, and whether or not kids should be going back to school in Oakville school districts. Oakville and South County in general have, we have noticed we have more complaints about masking in South County, and certainly the proximity to Jefferson County, where they do not have a masking mandate, and some back and forth mobility may be contributing to that. But St. Louis County is working, and St. Louis County Department of Health is working with businesses in South County to reinforce our masking mandate, to reinforce those guidelines, to help them understand those guidelines, to help them communicate with their patrons, and to try and improve masking compliance in the Oakville area, which we believe is part of the challenge to their high rate of COVID-19 infection in St. Louis County. As far as whether or not grade schools will begin transitioning in Oakville to virtual learning or a hybrid model, that's something that will be worked out through that school district, based in part on the trend of cases, based in part on the number of cases that are in particular in those younger students, those kids under 10, because those cases in Oakville may actually be in the older students, 15 to 19-year-old and older adults, and the younger students may be somewhat protected.
I have one final question. What is your response to the bill by Councilman Fitchenharder that would limit the length of a state of emergency long-term powers should be solely with the county executive?
Yeah, so the question is about a proposal before the county council to limit the ability of the county executive to issue public health, public safety orders to protect the health and welfare of our residents in St. Louis County. This was initiated, actually the first version of this a few weeks ago when our mask mandate went into place. The mask mandate, of course, initially was met with some pushback, but has been much more widely accepted in St. Louis County as people understand how important it is and how it's one of the best ways to keep, to keep COVID in check in our community until we have a vaccine. And probably one of the least impactful on folks' personal lives. But this legislation is driven by opposition to the mask mandate and other public health orders in general, and certainly the conversation resurfaces every time we need to do something to protect the safety of people in St. Louis County. But I do believe that this authority rests with the county executive and should continue to rest with the county executive as it does with every chief executive in every similar jurisdiction in the country. Any other questions? Okay, thank you.
Thank you.